What are the dental specialties? Dentistry is a diverse field with several specialized areas, often referred to as dental specialties. These specialties require additional education and training beyond dental school to become experts in specific aspects of oral health. Here are some of the recognized dental specialties. Orthodontics and dentofacial orthopedics. Orthodontists specialize in diagnosing, preventing, and treating dental and facial irregularities, such as misaligned teeth and jaws. They commonly use braces, aligners, and other orthodontic appliances to correct these issues. Oral and maxillofacial surgery. Oral surgeons are trained to perform surgical procedures related to the mouth, jaw, face, and neck. This includes tooth extractions, dental implants, corrective jaw surgery, and treatment of facial injuries. Periodontics. Periodontists focus on the diagnosis, prevention, and treatment of diseases and conditions affecting the gums, periodontal diseases. They perform procedures like scaling and root cleaning, gum grafting, and dental implant placement. Pediatric dentistry. Pediatric dentists specialize in the oral health care of infants, children, and adolescents. They have expertise in child psychology and provide age-appropriate care, including preventive services, restorative procedures, and behavior management techniques. Endodontics. Endodontists deal with the diagnosis and treatment of diseases and conditions related to the dental pulp and the tissue surrounding the tooth roots. They perform root canal therapy to save damaged or infected teeth. Prosthodontics. Prosthodontists focus on the restoration and replacement of damaged or missing teeth. They design and create prosthetic devices such as crowns, bridges, dentures, and dental implants to restore oral function and aesthetics. Oral pathology. Oral pathologists specialize in the diagnosis of diseases and conditions affecting the oral and maxillofacial regions. They play a critical role in identifying oral cancers and other oral lesions. Oral and maxillofacial radiology. These specialists use advanced imaging techniques, such as X-rays and CT scans, to diagnose and manage oral and maxillofacial diseases and conditions. They often work closely with other dental specialists. Dental public health. Dental public health professionals work to improve the oral health of communities and populations. They focus on policy development, research, and education to promote oral health and prevent dental diseases on a broader scale. Dental anesthesiology. Dental anesthesiologists are trained to provide anesthesia and sedation services to manage pain and anxiety during dental procedures. They ensure patients are comfortable and safe during treatment. Geriatric dentistry. Geriatric dentists specialize in providing dental care to older adults, addressing the unique oral health needs and challenges associated with aging. Special care dentistry. These dentists focus on providing oral health care to individuals with special needs, such as those with developmental disabilities, physical limitations, or complex medical conditions. What are the dental subspecialties? Dentistry encompasses several subspecialties, which represent even more specialized areas within the broader dental specialties. These subspecialties often require additional training or expertise beyond what's covered in the primary dental specialty. Here are some of the recognized dental subspecialties. 1. Orthodontic subspecialties. Craniofacial orthodontics. Experts in treating patients with craniofacial anomalies or complex facial deformities, often in collaboration with oral and maxillofacial surgeons. Orthodontic restorative dentistry. Specialize in coordinating orthodontic treatment with restorative procedures, such as crown and bridge work. 2. Oral and maxillofacial surgery subspecialties. Oral and maxillofacial pathology. Focus on diagnosing diseases and conditions related to the oral and maxillofacial region through microscopic examination of tissue samples. Oral and maxillofacial radiology. Specialize in the interpretation of advanced imaging, such as cone beam computed tomography, CBCT, scans, to aid in diagnosis and treatment planning. 3. Periodontics subspecialties. Periodontal prosthesis, Combine periodontal and prosthodontic expertise to treat patients with complex needs related to gum health and tooth replacement. 4. Prosthodontics subspecialties. Maxillofacial prosthodontics. Specialize in designing and creating prosthetic devices for patients who have lost facial structures due to cancer, trauma, or congenital conditions. 5. Oral medicine. Oral medicine and orofacial pain. Experts in the diagnosis and management of conditions involving chronic orofacial pain, including temporomandibular joint disorders, DMD, and other oral medicine-related conditions. 6. Oral and maxillofacial radiology subspecialties. Dentoalveolar radiology. Focus on the interpretation of radiographic images specifically related to the teeth and supporting structures. Oral and maxillofacial cone beam computed tomography, CBCT, imaging. Specialists in the use and interpretation of CBCT scans for precise diagnosis and treatment planning. 7. Oral pathology subspecialties. Oral medicine and oral radiology. Combine expertise in oral medicine and radiology to diagnose and manage various oral and maxillofacial diseases. Oral pathology and forensic odontology. Apply their knowledge to forensic investigations, including identification of human remains based on dental records and analysis of bite marks. 8. Dental anesthesiology subspecialties. Pediatric dental anesthesiology. Focus on providing anesthesia services to children and adolescents undergoing dental procedures. Special care dental anesthesiology. Specialize in administering anesthesia to patients with special needs, such as those with developmental or medical conditions. How often should you go to the dentist? The frequency of dental visits can vary depending on individual oral health needs and risk factors. However, a general guideline for most people is to visit the dentist for a regular checkup and cleaning every 6 months. These routine dental visits serve several important purposes. 1. Preventive care. Regular dental checkups allow dentists to catch and address dental issues early, often before they become more serious and require more extensive and costly treatment. 2. Professional cleaning. Dental hygienists can clean your teeth more thoroughly than you can at home. They remove built-up plaque and tartar, which helps prevent gum disease and tooth decay. 3. Oral health education. Dentists and dental hygienists can provide guidance on proper oral hygiene practices, including brushing and flossing techniques, as well as dietary recommendations to maintain good oral health. 4. Early detection of problems. X-rays and dental examinations during checkups can identify issues such as cavities, gum disease, oral cancer, and problems with existing dental work, example, fillings or crowns. 5. Customized care. Dentists can assess your individual risk factors for oral health problems and tailor their recommendations accordingly. Some people may need more frequent visits due to specific concerns or conditions. It's essential to note that the recommended frequency of dental visits can vary from person to person. Some individuals with a history of dental problems or certain medical conditions may need more frequent checkups, such as every 3 to 4 months. Conversely, those with excellent oral health and a low risk of dental issues may be able to extend the time between visits to a year. Ultimately, it's best to follow your dentist's recommendations based on your specific oral health needs and risk factors. If you're unsure about how often you should see the dentist, consult with your dental healthcare provider to create a personalized dental care plan. Regular dental visits are essential for maintaining good oral health and preventing dental problems.